Shocking CCTV footage revealed an alleged beer worker urinating into a tank in eastern China. The video was filmed in the city of Qingdao in Shandong province on October 19. A man was seen sneaking into a storage room, taking a quick look around, and then standing atop the stored materials to urinate. By the evening of October 20, the scandal had grown, so significant that officials from Tsingtao Beer were compelled to address the unsettling footage circulating online. They promptly assured the public that the entire batch of malt in question had been sealed off and is currently under police investigation. Adding a twist to the tale, an insider with knowledge of the situation shared a preliminary finding. Contrary to the viral rumors, the man caught in the act and the one filming the video were both external contractors, not direct employees of Tsingtao Beer. The location where this act took place wasn't the brewery's primary storage, but appears to be a vehicle compartment of a logistics carrier responsible for transporting ingredients. The insider also added that the brewery, being a food enterprise, is equipped with numerous surveillance cameras. There's even a restroom very near to the incident site, making the man's act all the more baffling. Both the individual filming the footage and the man seen urinating have since been taken into custody by the Pingdu City Police Department. The video was provided by local media with permission. Health and Wellness Minister, Drive Christopher Tufton, ignited substantial outrage from members of the Jamaican diaspora when he recently suggested that overseas medical missions to the country could be doing more harm than good, especially in relation to dental care for citizens. Tufton's comments, which were initially widely interpreted as a sweeping critique of visiting medical missions in general, sparked a wave of indignation among the Jamaican diaspora. Members of the overseas community, many of whom organize or participate in the missions, expressed the view that their contributions were being undervalued or even disparaged. Tufton then clarified his position, stating that his comments were misinterpreted, claiming that he was only referring to a small number of visiting dental teams. He added that he fully recognized the invaluable contributions of the majority of medical missions that adhere to the highest standards of care. The statement I made to recognize Oral Health Month, I was focusing only on oral health, and not medical missions generally, Tufton told reporters, referencing his address during a visit to the dental department at the Cornwall Regional Hospital to recognize Oral Health Month on October 12. There are cases where missions come in, sometimes registered, sometimes unregistered, particularly when they are unregistered, accompanied by dental students, with some getting experience and focusing exclusively or primarily on extractions, he explained. The minister maintained that in the latter cases, sometimes some harm is being done, despite leaders in the diaspora not agreeing wholeheartedly with the stance. Overseas medical missions have been a critical part of Jamaica's healthcare system for years. These missions, often staffed by professionals from the Jamaican diaspora, provide much-needed healthcare services, including dental care, to communities that might not otherwise have easy access to, or financial ability to access such services. On October 12, however, Tufton argued that some dental teams, in their well-intended efforts, may inadvertently cause harm by not providing consistent follow-up care after damaging dental extractions, thereby leaving patients vulnerable to complications. We want to put a pause or reduce that. For starters, it doesn't feel right or look right, because it can be interpreted as the missions coming in to take advantage of our population by practicing to extract teeth and then leaving these Jamaicans in a state where they now have other issues, said Tufton at the event.
Was a big issue.
According to the minister, some residents who attend
around
such free health clinics hosted by the visiting missions end up suffering from additional, or worse, oral health challenges. If extraction is all you are coming to do, and bringing dental students who may be competent to do it, but are just coming to fulfill hours and practice, we the Jamaican government, are going to be less welcoming. Because what we want is a proper, oral health program, declared Tufton then. Consequently, he proposed that he will be directing health officials to craft a policy document that would effectively monitor and authorize missions visiting the country to conduct dental procedures.